I've tried everything and nothing is working for me. This is a very common statement I hear in clinic, especially after patients have sought various different types of treatment and medical opinions from different providers, and now they're sitting in front of me and they don't know what to do. And this is often a problem in relation to skin and hair concerns. So if this sounds like something you might want to know more about, keep watching. Hello again and welcome to my YouTube channel. This is Dr. Eve's Skin and I am really glad to have you here. So on this channel we discuss different problems and the interface between medicine, skin and beauty, and I think this is something that you might be really interested in, particularly as it might intrigue you as to what the video is about. So this video is definitely for you. So before we dive into the topic, don't forget to like and subscribe and to click the bell button for this channel to know more about topics like this and to hear more about our videos. So let's get into it. Firstly, what is personalised medicine and how does it relate to dermatology? Great question. Well, in traditional medicine, a one-size-fits-all approach is often used when it applies to patients. So with similar symptoms and conditions, we often use one thing that works for most people, and they are treated with the same standard treatments and therapies. This is usually a great thing. However, this approach doesn't normally take into account differences between individuals and can significantly impact on their ability and their response to treatment. So it's certainly something that we are really interested in. Personalised medicine is often referred to as precision medicine. And the reason for this is that it applies a different medical model that separates patients into different groups, with medical decisions and practices and interventions being made for that person in that group and tailored to the individual based on their different experiences, their predicted response to treatment and or their risk of disease, including their risk of response to treatment. So personalised medicine utilises our understanding of the role of DNA and how it plays a factor in our health. It can help us to transform how we think about healthcare and also help us to be able to deliver the 4 Ps. So the 4 Ps are prediction and prevention of disease. And we can also do precise diagnosis with personalised and targeted interventions. And far more, you can be participants in the role of your treatment. So this allows us to be able to get our patients a faster diagnosis and a faster response to their treatment. And this can be done based on the condition and their unique situation. So we can offer tailored treatments based on what we would expect will be more effective for them rather than just general treatments, and we can help them to experience fewer, if any, side effects. That sounds good, right? Well, the scope of this is that we can move away from simply managing an illness and once you are already sick, but actually promote health and in fact possibly even prevent disease. That would be something that we'd want to do based on your genetic predisposition and preventing you from developing a condition in the future. So that's where medicine wants to go with this. All of this utilises your unique information, which is locked up within your DNA, and it can be as simple as a simple cheek swab. So certainly something you can do without any harm to yourself. So how is this relevant to dermatology? Well, it's relevant actually because with personalised skincare, products as patients can be married together. And we know that personalised treatments, we can provide personalised skincare products and management plans for our patients. And we know that these treatments will be free of ingredients and things that may cause sensitivities or allergies or reactions in the patients and things like breakouts. So this is really, really important. Our formulas are customised to specifically target the problem that the patient is developing or dealing with, whether those are addressing hair loss or reducing wrinkles or preventing breakouts. And really, it's great to do everything. So overall, it can really impact the appearance of someone's skin. This allows us to achieve the results that you're looking for faster. And this can be something that can be done anything from personalised skincare treatment plans to targeted treatments for hair problems or skin concerns to more complicated conditions. One of the things that we do in our clinic as a form of personalised medicine is tricho test, which is a form of treatment we use to manage those who are experiencing hair loss. And that's something that's really, really effective. In recent years, more treatment has been available to give excellent results in the management of hair loss. But for some people, not all these treatments will work. And that means we're kind of doing a trial of treatment, and often it can feel like a bit of a waste of money. So by utilising personalised medicine, we're able to give you a confident treatment plan, knowing that this will work for you. Why? It's going to yield results because your DNA says so. So this is the reason why we find that personalised skincare can be really, really helpful. And we know that we have to remember that all unique individuals have different responses to treatment. Skincare is really complicated, and as a result of that, we have to consider the nuances, and that must be taken into account every time we come up with different treatment plans. We know that some of us have allergies to common medications like penicillin, and others don't, and that's where we take these things in consideration. Anything we can do to waste time from the trials of treatment and going on another one should be good, right? So I've told you all about the reasons why I think personalised skincare is brilliant. But are there any cons to why personalised treatment shouldn't be done? Personalised skincare doesn't typically come at a cheap cost. As you can see, it's not on the high street, and average in comparison to high street treatments, it's definitely going to be a lot more than that. But it's certainly something that you would need to consider if you're going to approach that. The cost of genetic testing and analysis and infrastructure required to be able to do that can be quite costly, and it's unaffordable for many. And this is the reason why it might not be covered by some insurance and healthcare providers, or including government-based organisations like the NHS. So it's unfortunately the domain of private clinics alone. And that's the reason why clinics like mine offer it, but you wouldn't be able to go to your personalised primary care practitioner about it. Personalised medicine also relies very heavily on genetic data and personal information to function in order to give you this treatment that you're looking for. So there are obviously concerns about personal information and privacy. And that's why it's of utmost importance that you choose a licensed and regulated medical professional who has experience in understanding your personalised treatment, but also about protecting your data. We have a duty of care to not only protect your personal information, but also your data, no matter the form it comes in. So this is something that you should discuss with your professional if you're approaching them with regards to personalised medicine. And if you feel that you don't want to do it, you can withdraw your medication or your treatment if you want to, and that's all within your right. So that's a whistle-stop tour of why personalised medicine is quite interesting and why I think you might find it helpful for you. So if you found this video interesting and you want to know more about it, please don't hesitate to pop onto our website, which I'll link down below, and you can book a consultation today. Otherwise, thank you so much for watching, and I'll see you in my next video. Have a great day.